First, is the lockdown of the unvaccinated ever justified? In this week's cover piece, Ross Clark looks at the protests starting across Europe because of the threat of another lockdown. Fraser Nelson, editor of The Spectator, joins me now, together with Dominic Wilkinson, a professor of medical ethics at the University of Oxford. Fraser, Ross writes about lockdowns for the unvaccinated in Europe. To start, what is happening on the continent right now?
Well, the COVID situation is getting quite significantly worse. Austria has seen the steepest increases. We're now seeing hospitals full yet again. Very familiar stories to this time last year. The difference being that we had thought in the summer that Britain was getting the worst of it and that continental Europe seemed to be relatively clear. This goes to show that COVID keeps surprising us, and now we're getting the same conversations in the continent, whether to lock down or not, but also whether to have lockdowns of the unvaccinated. This was Austria's innovation a couple of weeks ago. And the political language in the continent is changing also quite significantly. There's now a phrase which is being heard in Germany, in Bavaria, in the Czech Republic, but this is a pandemic of the unvaccinated. In other words, that the trouble is being brought to the countries by people who are refusing to get vaccinated. And now this is beginning to collide in a very interesting and rather alarming way with existing political divisions in Europe. In Germany, for example, the unvaccinated disproportionately tend to live in East Germany and vote for AfD, the kind of the far-right populist group. And the AfD, so you're seeing this kind of overlap between what we would typically regard as far-right populists, fairly or unfairly, and people who are now complaining against vaccine mandates and the overall issue of civil liberties. And that's something that Nicholas Farrell looks at in this week's magazine, the paradox of parties that can pretty much genuinely be called fascist, campaigning in the cause of liberty against the sort of left-leaning centrists who are, I guess, against the civil liberty argument and more in favour of lockdowns and compulsory vaccination. So we're seeing very strange dynamics, but as Ross argues in his cover piece, it seems to be merging very quickly into a kind of culture war. And it's not just in the British press that's making this point. Henrik Broder has written a very good piece in Die Welt today, in German, where he makes the point that the language now is almost as if you're talking about the heretics, the witches, the deserters, the kind of a subset in society on whom our woes can be blamed. He says that politics gets into a very dangerous place when the debate goes down that line. And that's what we're seeing the debate slide into in the continent.
Now, Dominic, Fraser mentions the fact that this is almost being referred to as a pandemic of the unvaccinated in certain countries, and Austria's decision that they're probably the first to have this idea of a lockdown just for the unvaccinated. Do you think that raises a moral dilemma?
Well, there are a series of moral dilemmas that we've faced across the pandemic. Broadly speaking, one of them that we're seeing raising its head again is the balance between safeguarding well-being and health of the population and protecting the liberties of individuals to make decisions for themselves and to go about their normal lives. There's also a kind of third factor, which is about treating people equally. So we've referred to this as a pandemic trilemma of choices between freedom, health or mortality, and equality. And you can't have all of those values. You make your choices and then you get the results, both in terms of the ethical values that you sacrifice and, of course, the impact on population and on excess mortality.
And Dominic, on that, do you think that it is morally justifiable to have a lockdown just for the unvaccinated, if we're thinking about the greater good, say?
So in terms of lockdowns and selective lockdowns are in effect just an extension of what has been debated for some time, which is the notion of vaccine passports. And basically that's about treating people differently based on their risk of transmission of the virus and prior to that whether or not they've had the vaccine. Now, there's a variety of questions about that. Is this an effective way of managing the vaccine? Is it proportionate to the risks at stake? Is it necessary? Are there other ways around it? Those three issues, effectiveness, proportionality, and necessity, are key ethical considerations in working out whether this is appropriate. It's useful to think about the alternative. So if you're if you've got a massive spike in cases, as they're seeing in some parts of Europe, and your health system is seriously under threat, the alternative is to institute a generalised lockdown, as indeed some European countries are having to at this point in time, or to say we're going to spare from that lockdown those who are at lower risk of ending up in hospital or of transmitting the virus. For many, the idea of a selective lockdown will look more attractive than bringing the whole community again to a screaming halt and sending everybody back to their Zoom offices and their homes.
Fraser, do you agree with that? It's a more attractive proposition?
No, I do think the level of social segregation the vaccine passports and selective lockdowns proposes is a really deeply disturbing notion. Again, we need to look at who's on the right and the wrong side of this vaccine divide. In Britain, if you're poor, you're far more likely to be unvaccinated than if you're rich. If you're black, you're something like 3 or 4 times more likely to be unvaccinated than if you're white. Now, it's not entirely clear why these divisions have fallen the way they have done, but there's no denying, we've got the data, this is exactly what is happening. Now, do you want to take a society already quite badly struck by social divisions and make these even worse? Does the state ever have any moral authority to deprive from a certain section of society their civil liberties? I'm not sure that's the case. I think the argument for lockdowns, to be honest, is borderline. But if you are going to apply them to everybody, at least is better than targeting people who you rightly or wrongly think pose a greater risk. Because let's remember that the argument here is taken on the premise that the unvaccinated pose a far greater risk than the vaccinated. But that, when you look at it and drill down, that evidence is far more shaky than you might think. In Ross's cover piece, for example, I'm just reading it here, he talks about this German study which shows that 80% of those refusing to be vaccinated don't have a problem with vaccination. In general, they're just concerned about the safety implications of this particular vaccine. Is that necessarily a wrong and indefensible position? And also, when you look at the data for who passes on infections, then it's far more difficult to say that the unvaccinated pose a far greater threat than the vaccinated. Because if you are vaccinated, you're far less likely to get ill yourself, you're far less likely to end up in hospital. If you look at the hospital figures, overwhelmingly, the ICU units are full of those who didn't get vaccinated. But when it comes to passing on the virus, then the studies show it's pretty murky, that it simply isn't the case. But if you take the vaccine, you're not going to pass it on, and if you don't have the vaccine, you do. And also, let's remember there's a third category. I think this is quite important. That there's a third category of people who haven't had the vaccine, but have had the virus. Now, there's a study recently showing that previous natural immunity is a lot more reliable than vaccinated immunity. So if somebody has had COVID, has been in bed for 2 weeks with COVID or worse, then that person really is very unlikely to pass it on. So why, ethically, would you not include them amongst the people who you're allowed to be given their liberties with? And also, the other ethical dilemma here, and I'd be interested to hear thoughts on this, is say you're going to fire somebody for not taking the vaccine. This is what the British government has done with care home workers. No jab, no job, that's been the rules. Now, when I asked Sajid Javid about this, the Health Secretary, a few weeks ago, he said that it would be a concession. He doesn't want to make a concession to those who believe anti-vax propaganda. Now, that's one category of people. But what about the category of people who absolutely believe in vaccination, but cannot see what medical advantage you take from being vaccinated if you're already naturally immune, a vaccine which, let's remember, could save the life of somebody in the third world who hasn't yet been offered it. So that category of people, morally, can you really fire them if you can't argue but they pose a COVID threat or a greater COVID threat than people who haven't had the virus but have already been vaccinated? So it's far more complicated in the real world than the theoretical exercises are making out. And that's why I think you're seeing protests in Europe right now. People just reject the rather facile way in which vaccine passports and lockdowns for the unvaccinated are being sold.
So it's useful here to see one kind of area of obvious agreement between us, which is about the importance of focusing on what's ethically relevant. So in terms of transmission of the virus, that what's relevant is an individual's risk of transmitting the virus. And of course, if they have had a vaccine or if they've been unfortunate enough to have the infection and then have recovered, they potentially are at equivalent risk and ought to be then treated equivalently, either both locked down or both allowed to go about their normal lives. So that, I think, is one of the reasons why on the continent many of the vaccine passport schemes and suggestions in terms of selective lockdowns have treated those who have the vaccination and those who've recovered from COVID similarly. The UK approach in terms of mandatory COVID vaccination for care home staff or NHS workers hasn't taken that approach, and I and others have criticised the government. I totally agree that it's not fair to remove somebody from their job on the basis that they haven't had a vaccine where they've got evidence, there is reasonable evidence that they've had an infection and are not at risk of passing on the virus.
That they can prove they've got antibodies, for example. That's a fairly easy way of doing it.
So antibodies, or they've had a positive PCR test within a period of 6 months. And indeed, that's already recognised in terms of NHS COVID Pass. So there's already a structure for doing that. It doesn't seem like there's any sensible reason why the government couldn't introduce that to their policy. But in terms of just stepping back to this question of transmission and the approach in the continent, it's worthwhile recognising what's fundamentally... There are two reasons why somebody should get vaccinated. One is for their own health and their own well-being. And of course, when it comes to state intervention in somebody's life for their own benefit, we understand that that's a paternalistic intervention. And the great political philosopher John Stuart Mill has kind of very clearly encapsulated the notion that the only justifiable reason for the state interfering in an individual's liberties is to prevent harm to others. Harm to the self is not enough. So, harm to the self for an individual's own health is not a good reason for having a vaccine passport or selective lockdown. Harm to others might be. Now, as you point out, the effect on transmission is not as dramatic as perhaps people had hoped. There is a reduction in transmission with vaccination, but it's not as clear as those who are vaccinated pose no risk of vaccination. Those who are unvaccinated and not immune pose a huge risk. There's a difference, but it's not as large perhaps as we might like. But there's a different way in which the unvaccinated pose a risk to others' health. And that's through getting sick and consuming scarce resources over winter. So the NHS is already, despite the fact that actually we're not facing the enormous spike of cases of Europe, is already kind of groaning and creaking and in danger of falling over.
But that's not to do with COVID, is it?
No, well, that's because of the resources. It's because of the flow-on effect of COVID and the ongoing kind of number of cases that are affecting our hospitals. So there's a combination of factors. But if you had a further spike of cases with a significant number of individuals who are then becoming critically ill, what you'd then find is that would pose a risk to other people, both people without COVID who couldn't then get into hospital, have their operations, have their cancer surgery, all the flow-on effects, and of course other people with COVID who would be competing with them for scarce ICU resources. So one of the plausible rationales for a selective lockdown in Europe, although again I agree it's debatable whether that's the right approach on balance, but one plausible basis is to say, look, if our hospitals are at risk of falling over, one way of reducing that, avoiding that, is to lock down those to prevent them getting sick and then needing those hospital resources.
I would say there that you need to look at the science behind this. For example, how sure are we that lockdowns really do serve as this emergency stop, which the theorists imagine that they do? If you look in the British example, for example, we have the virus was sent into reverse before lockdowns took place. Look at Sweden, they've had no lockdowns there, and they were twice able to force the virus into reverse by not resorting to lockdown, not depriving anybody of their civil liberty. So again, the argument, which are pretty sweeping government powers, saying to see you're not allowed to go to work, you're not allowed to go to the pub, you're not allowed to leave your life, you're not allowed to go see your family. If this is not on a strong scientific basis, then there's really no moral argument for this at all. So right now, I think we're skipping the really important part, which is, does the logic actually work? And right now, I'm afraid to say, we've had 18 months of lockdowns, very mixed evidence as to whether they are effective. In Sweden, a demonstration of how liberal society can keep its values while fighting back the virus. and overall, very important questions which many of those in the streets are raising in protests right now.
So I think there are really important questions, again here, about the effectiveness of different interventions and then their proportionality relative to the benefit. I think I interpret the evidence quite differently to you, that there's very clear evidence that those countries that have chosen to lock down have had, as a result, a very significantly fewer overall deaths. So Sweden has had lower deaths than some other countries, but has had very substantially more excess deaths than its immediate neighbours with very similar populations and other
But very, very different urbanisation levels. So that all, I mean, Sweden's more urbanised than Britain, so we can't really make that comparison.
So the UK has had dramatically more excess mortality than a number of, again, relative comparator countries on the continent.
And we locked down more than anybody pretty much last year.
Well, no, I mean, our lockdowns were, by and large, instituted later, less stringently than a whole series of other countries.
They lasted a lot longer. Britain is the case study, I'm afraid to say, for those who question the efficacy of lockdowns in keeping the death rate down, either amongst those with COVID and, importantly, amongst the under 65s. Our death rate is really quite high by European standards. That implies that the side effects of lockdown might be greater than we're looking at. So, again, I really think we need to be very clear about the science before we're talking about depriving anybody of their basic liberty.
I mean, again, so there's scientific questions, important questions, and then there's ethical questions. So in terms of the science, it's important to look at whether lockdowns work, whether they cause more harm than good overall. How
clear do you think that science would need to be? How clear do you think, how sure would we need to be about the science before we issue lockdowns and deprive people of civil liberty on that basis?
Well, I mean, one of the challenges, of course, in a pandemic is that you have to make decisions when the evidence is imperfect and there's uncertainty. One of the interesting questions has been not simply about whether to lock down, but how much to lock down and when to lock down. Of course, in the UK, we've chosen to relax lockdown earlier, anticipating that would get a surge in cases before the winter. Other countries have made different choices and are perhaps paying the price for that with now a surge of cases that coincides with the winter. You have to make decisions in the face of uncertainty. I don't think we have the luxury of waiting until there's cast iron evidence. I think we have in the UK made a series of mistakes by waiting to make decisions in the past. At the moment, I don't think there is a pressure on the UK to make decisions acutely to lock down or to selectively lock down again, though that could change. And partly because the key factor, which is about our health system being under significant threat, is we have very little room to move because of the nature of our health system and its chronic shortage of resources.
Thanks, Fraser and Dominic.